It is a great day for science. It is a great day for humanity. When you realize that your vaccine has a 90% effectiveness, we should be able to have up to 50 million this year, 1.3 billion next year.
A groundbreaking announcement in the fight against COVID-19. Early results show Pfizer's coronavirus vaccine is at least 90% effective. So what does it mean moving forward? Associate professor at NYU School of Medicine and author of Coronavirus Made Easy, Dr. Devi Nampiaparampil joins me now. Good to see you this morning. Thanks for being here.
Thank you. Thanks for having me.
Of course. Okay, so we're excited to talk about this. First of all, I want you to explain what this news means to you and when you think we could perhaps see an emergency use authorization.
Well, Pfizer is a trusted brand, so to release this information, I'm cautiously optimistic about it. Now, we have to still see what the medical data shows. They've only issued this in a press release so far. But I do have concerns about some of the politics involved in this, well, several different things. So to begin with, when you're checking anything, whether it's a vaccine or any kind of preventative tool, you have to test it in certain ways. So let's just think about something different for a second, like mosquito repellent. You would try it on people, let's say, in a tropical climate. Some people get the mosquito repellent, some people don't. And when a certain number of people get sick, then you compare the two groups, when a certain number of people get mosquito bites, right? Mm-hmm. If nobody gets mosquito bites, then maybe you're not in the right area. And if everybody gets mosquito bites, then your repellent doesn't work. So in this case, Pfizer had a set number of people that they were waiting for to get sick before they could do the analysis. But what happened was they waited a little bit longer than that. More people got sick than that, about 30 more people. So there was a delay in reporting the results. Whether it's purposeful or not is unclear. But I think what will happen is that the people on the Trump side, the Trump supporters, may have an issue with the vaccine because all of these results were released after the election rather than before, when Trump was promoting the vaccine
itself. If I can just interrupt for a second, because, the politics part of this conversation is definitely a thing that people are talking about, but I want more the medical perspective, if you can, of, what this means for us, the people who, layman out here who are wondering when we could potentially see a vaccine for us, for everyone.
Sure. Exactly. So this is the first step to find out how effective it is. Then there are going to be issues in terms of checking it with a larger number of people and ramping it up in terms of the production. So Pfizer has paired with another company, BioNTech, which should help in terms of that issue. But then we have an issue in terms of distribution as well, because this particular vaccine candidate needs to be stored at a cold temperature. So for people who extremely cold temperature. So for people at home, they can be optimistic, but there are a lot of logistical issues that have to be sorted out. For example, how will that be transported? How will it be stored? How will it be administered to the American people? And how much will it cost? So there will be issues in terms of who gets it first, not just in this country, but across the globe. So I think, hopefully we can have it by the spring, but there are a lot of factors that still need to be ironed out.
Yeah, Dr. Anthony Fauci last night was saying that, if you want to look at another bit of good news, he said Moderna has a similar vaccine. Their results should be in soon, he said. So perhaps we could see, more than one vaccine that's effective, which would be great news. And he also said that we could have doses to give to people by the end of November or the beginning of December. So he said all around that's good news. And, we're hopeful for that. Dr. Devi, thank you. Appreciate it.
Oh, yes, of course. Thank you.
Okay, as vaccine progress continues, one Democrat is already politicizing it.
The bad news is that it's about 2 months before Joe Biden takes over, and that means this administration is going to be implementing a vaccine plan.
The growing backlash over Governor Cuomo's comments, and President-elect Joe Biden says he'll rejoin the World Health Organization on day one.